Video we'll see about atypical ribs. Before going into atypical ribs, what is a typical rib? So what are the features present in a typical rib? If any of these features is not present in a rib, then it is called as a atypical rib. So a rib should be flat in the vertical plane such that it should have external and internal surface and superior and inferior margins. And it should have two articular surface. As we mentioned earlier, it should have superior articular surface and inferior articular surface on the head. And it should have a tubercle with one articular surface on the tubercle, and also it should not have any other additional tubercle. Only one tubercle should be present. So any rib should be present in a vertical plane, and it should have two articular surface, one which articulates with the above thoracic vertebra and the inferior with the corresponding thoracic vertebra, and the tubercle whose articular surface articulates with the transverse process of corresponding thoracic vertebra, and should not be any other extra tubercle. So these are the features of a typical rib. If a rib lacks any of these four features, then it is called as an atypical rib. We'll see about what are the atypical ribs. So these 5 pairs of ribs are called as the atypical ribs: 1st, 2nd, 10th, 11th and 12th. We'll see about first rib. So first rib, it is flat in the horizontal plane such that it has superior and inferior surface with external and internal margins. So whereas a typical rib should be present in a vertical plane such that it should have external and internal margin with a superior and external internal surface with a superior and inferior margin. It has opposite to that of it. And then second feature is it has only one articular surface on the head. Why there is only one articular surface on the head? It is for a reason also, such that if we have two articular surface, the above articular surface will be articulating with the above thoracic vertebra. So it will be articulating with the 7th cervical vertebra, but it should not articulate with the 7th cervical vertebra. So only one articular surface is present such that it articulates with the 1st thoracic vertebra alone. And it also has a tubercle with an articular surface which articulates with the transverse process on the 1st thoracic vertebra. But in addition to that tubercle, it also has an additional tubercle called as a scalene tubercle. Anterior and posterior to this tubercle, we have two smooth grooves. The anterior groove is present due to the subclavian vein, and the posterior groove is formed due to the subclavian artery. So this is the scalene tubercle. So anteriorly the groove is present due to subclavian vein. I have denoted in blue color, and posterior to this tubercle is the subclavian artery which forms the posterior smooth groove. So I have denoted in red color. So these three features are which makes them an atypical rib. It is present in horizontal plane such that it has superior and inferior surface with external and internal margin, only one articular surface such that it could not be able to articulate with 7th cervical vertebra, and an additional tubercle is present which is the scalene tubercle. So it has two smooth grooves which is present due to the subclavian vein and the subclavian artery. So we'll move on to the second rib. So rib 2, it is also flat in horizontal plane like that of the first rib. So all the rest features of a typical rib is present in the second rib, only it lacks this feature. So 10th rib. 10th rib, it has only one articular surface on the head, such that it articulates with only the 10th thoracic vertebra, not with the 9th thoracic vertebra. The rest features are present as that of a typical rib. So 11th and 12th, like 10th rib, it also has only one articular surface on the head, such that 11th can articulate only with the 11th thoracic vertebra and 12th can articulate only with the 12th thoracic vertebra, not with the above thoracic vertebra respectively. And then it also lacks the tubercle. Tubercle is absent here, such that it cannot articulate with the transverse process on the corresponding vertebra. So we will have again a quick review about all the 5 pairs of ribs which is lacking any of the features of a typical rib. So we will see whether all these features are present or absent. So first rib, is it flat in vertical plane? No, it's flat in a horizontal plane. So this feature is absent. Rib 2 also like rib 1. And rib 10, 11th and 12th, they are flat in the vertical plane. So 2 articular surface, that is the superior and the inferior articular surface on the head. So it has present? No, it does not have. It lacks one articular surface. Whereas rib 2, it has both articular surface on the head. Rib 10, 11 and 12, they also lack only one articular surface are present. Tubercle, here tubercle is present, here also tubercle is present, here also tubercle is present, whereas in 11th and 12th ribs lacks the tubercle. Is there any additional tubercle? Yes, we have an additional tubercle called as scalene tubercle, whereas all the 4 ribs do not have any additional tubercle. So all the ribs lacks either of the features. It lacks either first 2 or these or these or these. So if all the features are present, then it will be a typical rib. Since it is lacking either of the 4 features, so they are called as an atypical rib. That's it about the atypical ribs. We'll move on to the thoracic vertebra in the next video.